Hello, everyone. This is Michael Jones, president of the Medical Exercise Training Institute, and we've trained personal trainers to make the transition from personal training to medical exercise training now for 28 years. So I know this situation, personal training versus medical exercise training, is one you're dealing with every day. If you've taken one of our medical exercise training or post-rehab workshops, you're still trying to make that transition. You're trying to jump from personal training over to medical exercise training. And you've done personal training for years, maybe for a decade or more. And you always go back to personal training. And one of your biggest concerns is, do I need to get rid of my personal training clients to now move my practice to medical exercise training? No, don't dump any of your personal training clients, because the longer you keep those clients, the more they'll need you for medical exercise training, because aging is just one of those processes that we see, or the aging client, in medical exercise training. So this isn't about dumping your clients. This isn't about getting rid of all your personal training clients. This is about now transitioning to medical exercise training. And it's really about the mindset more so than dumping clients. Don't dump your personal training clients. No way. You've developed relationships with those clients. They're going to be with you on an ongoing basis, and many of them will have hip replacements and arthritis and hypertension and other things. So you're going to use these clients eventually are going to transition from personal training to medical exercise training, and they're going to use you to help them manage their medical condition. So don't dump them out. Just simply say, okay, I'm going to keep these clients, but the mindset is I'm transitioning to medical exercise training. So with personal training, you probably think, I'm developing an exercise program for a client with a medical condition. Where it should be, with medical exercise training, I'm managing a medical condition with exercise programming, or with exercise. There's a different thought process, and this thought process usually will plug you into doctors, therapists, or chiropractors in your community. So with the personal trainer, you focus more on the fitness programming rather than the client's condition improving function. You do screen the client, you do a consultation in a PAR-Q, but you really aren't digging deep to find out where the client is and what's going on as far as their medical issues. You just want to kind of get them started with an exercise program. Your assessment and exercise are in the same session. So instead of really doing an in-depth assessment, you do a cursory assessment, but you want to get them started with exercise, because you want to get them exercising right away, because as a personal trainer, that's what you do. You work around the client's medical condition. So instead of actually coming up with a strategy to manage their medical condition, and the personal trainer uses medical condition, what we should say is specifically, what is the client's condition? So you're working around the condition rather than maybe developing an exercise program that will help with strengthening or improving movement or flexibility. You have a non-specific program and no MET protocol. So you're just kind of, putting together an exercise program as you go, rather than addressing specifically the issues for the client's condition or diagnosis. With that, you have no short-term or long-term goals. You don't document anything, and you're not communicating with the doctor, therapist, or chiropractor. You have a minimal understanding of clinical anatomy. Now, you're great at basic gross anatomy, muscle, bones, and organ systems, but as far as what specifically is going on with a meniscal tear or arthritic changes in the knee and those types of things, you're not 100% clear on. And your thought process is, if the client feels better, then the exercise always works. And that's true. One thing I've learned in some 34 years as a physical therapist, that exercise really does. It's the magic potion. It makes everyone feel better. But the question becomes, for you, the personal trainer transitioning to medical exercise training, are you improving the client's level of function? So the medical exercise specialist conducts a medical history interview. So not just simply a PAR-Q and some cursory questions, but really trying to dig deep into when this condition started, what's going on with it, what makes it better, what makes it worse, so you can now tailor an exercise program to that client's needs. Also, they perform an MET assessment, and they check the client's vital signs. Folks, you're going to have to start checking that client that's coming in that is telling you they have a medical condition. And I'll say this on any of your clients, personal training or medical exercise training, you got to check their heart rate and blood pressure at a minimum. Folks, you're the first line and last line of defense in this battle we have against chronic disease. You may pick up someone that's hypertensive that never knew it, okay? And that makes a huge difference. So you got to check vital signs. You have to identify the client's diagnosis, red flags, and any functional deficits during that assessment. We're not saying you're going to diagnose, but you're asking the client and identifying in that medical history interview the diagnoses the client has, and these diagnoses are coming from the client's physician, therapist, and chiropractor, and the client is reporting those to you. You do establish both short-term and long-term goals for the client in their exercise program. You focus on functional outcome measures. We've talked about those earlier in our blog, and check out our blog. We talk about those. You also refer to medical exercise training protocols to make sure nothing falls through the cracks when managing this client's medical condition with exercise. You do incorporate fitness and wellness components so that the client is improving with regard to their fitness and their wellness. You document MBT sessions, the assessment, and the progress, and you communicate with medical professionals. Now, this is just a few steps forward from being a personal trainer, and I know you want to make the transition, and we've got something that will help you, our Advanced Medical Exercise Specialist Virtual Workshop. It's October 20th through 23rd. Now, if you're watching this, you're probably one of our medical exercise specialists or post-rehab conditioning specialists and medical exercise program directors. You took our course back in the day and you had every intention of building a medical exercise training practice, but you're kind of stuck. You're kind of stuck between personal training and medical exercise training. Well, this course is going to help you make the leap. If you would go over to amesvirtualworkshop.com to get more information. You can do this from the comfort of your home because the actual on-site workshop, October 20th through 23rd, is completely sold out. We don't have any space available, but with the virtual workshop, we're going to record it. You can zoom in and watch everything and ask questions, and it'll give you that skill set now to completely transition from personal training to medical exercise training, and you're going to become part of our MedX Pro network. So now you can communicate with other personal trainers making the transition. So please, we look forward to having you in our Advanced Medical Exercise Specialist Virtual Workshop. Go to amesvirtualworkshop.com to get registered, and we look forward to having you. Please, we need you to make that transition. We've got some really important things that are going on here in healthcare, and we know exercise is the key to long-term management of many of these medical conditions. We need more people like you to help manage medical conditions utilizing exercise. So if you have any questions for me, email me at drmike@postrehab.com or go over to amesvirtualworkshop.com. We'll see you then. Take care.